Hello. So my hair is a mess. Oh, I tried to look appropriate and professional. I just Anyway, this is a good topic. Where a good assignment that I want situation, clinical experience. Yes, Aiden. You can open it. Sorry about that. So, once again, no new diagnosis. Okay, honey, drink some water. So, not a new experience. I mean, not a new diagnosis, but definitely a new experience. So, this situation occurred at work, and it was a patient there. She was bipolar, and she had a diagnosis. Excuse me, she was bipolar, and she was in a manic state. And as many people will agree, in this field, psychiatric mental health nurse practitioner, the psychiatric field, you have to make sure you are doing your best to stay professional. Sometimes it is very hard to not laugh. I will agree. A lot of times when I reflect, I have to think about you cannot just be laughing, especially when the patient know that you're laughing at them. That is not a good thing. So sometimes you can try to be professional, or you're being professional, and you hear something and you automatically laugh without even thinking twice. So what I would do is, like, because I'm already sometimes not looking at the patients, I'm charting or whatnot. So when I laugh, I try to act like I'm laughing at something that I'm looking at, or a coworker or something. I am professional enough to know not to let the patient know that I am laughing at them. So this one incident, I did see a patient in a manic state, as I spoke on in another video, when they were given an SSI and they were diagnosed. Okay, drink some water, honey. They were diagnosed. They were given the wrong diagnosis and given the SSRI, RI, and so they came back in a manic state. So at the job, so I come in, I'm talking to one of the patients. I'm like, I'm your nurse for the day. You know, I'm going to ask you a few questions. How do you sleep? How's your appetite? Do you have any depression or any anxiety? Do you have thoughts of hurting yourself or others? Are you hearing voices? Are you seeing things that only you can see and no one else can see? Are you going to groups? Are you taking your medication? So I'm asking these questions. And so she responds and she's like, oh, I'm a model. I'm not supposed to be here. I'm not taking this medication that they give me. That's for those people out there. They need that medication, not me. Yeah, they were giving me the medication and I was keeping it and spitting it out in the toilet, but now I refuse to take the meds. And so I don't need those medications. I go to court Monday and I'm going to be out of here. Like, I don't need this. My dad, he was a gangster, and I'm a gangster. My mom was a gangster. Do I go to groups? No, I don't go to groups. I was banned from them. Well, what did you do? Well, I stood up for myself. I stood up. My dad would be proud. And I stood up to those doctors. I slapped the doctor yesterday, and my dad would be proud because I'm a gangster. I don't have to be here. She cut the strings off a bathing suit. I'm like, that's a nice way to treat you. I'm a model. I'm a model from New York. I get free things anytime. I don't need that stuff. So she goes to court. She's talking like this to the judge, of course. And she comes back and they hit her with a 120, 60 days to be in a hospital. 60, 120, 180. It was, I've never seen the manic state, the euphoria. I mean, excuse me, the grandiosis. The grandiosis. Wow. It was a lot to see, and I enjoyed seeing it. I'm glad I seen it because in my practice I know what to look for. You know, it's good to put a term with a situation, so the definition of grandiosis, and just to see it in act, you kind of appreciate it. And I'm just happy about the clinical experience and also the work experience, because I really feel like I'm being shaped to be the best nurse practitioner, psychiatric nurse practitioner that I can be. Thank you.